Good afternoon, everybody. After hearing about the various skill modules and how they are being developed at AIIMS, New Delhi, now I'm going to talk about the innovations in medical education and what has been the role of e-learning in the development of these innovations. This content is primarily developed by myself and Professor Ambuj Roy. He's professor in the Department of Cardiology, and we are both involved in the e-learning component of the SET facility, and Professor Ambuj Roy is also an overall coordinator of the facility. What are the visions of the National Medical College Network? Now, as the needs of the 21st century healthcare system continues to evolve and the challenges that we have recently faced during the COVID pandemic and learnt a lot of lessons, medical students must be trained continuously to meet a multitude of professional demands and meet the unknown challenges that are posed. Given restraints on time and resources, curricular reform leaders have laid the emphasis on innovation and novel learning strategies. E-learning is a potential innovative pedagogy to be employed by NMCN and envisages access of substantive course materials by way of e-content to the student, faculty, and all healthcare professionals of each and every medical college in the country. What is the vision of NMCN? The healthcare delivered to patients and each mode of treatment. For instance, say a cancer patient, what is the mode of therapy decided upon for that particular patient, be it chemotherapy or radiotherapy or a combination of both or along with surgery? All this decision has been based on evidence underlying it, and one that is supported by extensive research investment that allows us to innovate and improve, and eventually has thus evolved into evidence-based medicine. Likewise, behind each of these treatments are clinicians, and their development is also worthy of innovation. By employing an organized approach to research investment, we can innovate medical education towards improving the quality of future healthcare personnel that we need and aim to produce. Introducing e-learning as a very important component in the National Medical College Network, shortage of trained medical faculty, continued increase in the number of medical students, need for learning on demand, optimization of travel and cost time of the healthcare professionals for training and skill development are some of the major thrust areas for considering e-learning as an integral component of the National Medical College Network. And what are the advantages of e-learning? E-learning overcomes limitations of space and time constraints faced by medical student community by leveraging the information and technology applications, and has immense potential and advantage to the student community globally, not only to the student but the entire healthcare professional community. However, challenges do exist in adopting new age learning systems and standardization across the country in public healthcare system. What is the scope of e-learning and its role in medical education? So basically, the major applications and utilizations of e-learning in medical education includes, some of them were earlier mentioned by Dr. Ravi, medical and medical specialty courses, allied health and paramedic courses and skill development, surgical training, simulations, trauma room simulations, empathy development, human anatomy exploration, bedside practice, overcoming language barrier, and problem-based learning and discussions. So e-learning as a proposed platform for medical education is envisaged to play a significant role in medical education and in MCN, and requires a robust design framework to develop and host new age learning systems for the medical community in the country. And some of the major essential key components of e-learning include, one is majorly the content of the whole module. Then you have the learning management system, which can integrate the content along with the management system, which is a software, and also will help in continuing assessment both summatively and formatively, and ultimately access of this content through the web portal. So various forms of e-learning content, data format, and application utilities are available to effectively deliver the content to the student community nationwide. And some of them include, say, ebooks or journals or reports, graphics, problem-based scenarios, quiz, test, course exercise worksheet, multimedia animated content, audio video images, webcast sessions, and so on. And the application utilities could be in form of virtual simulators, robotics, mobile applications, chat, or blogs. The learning management system, like we discussed about the Saral, which exists in AIMS presently, it's basically a single window software application for teachers, students, and administrators to plan, manage course curriculum, instructional content, online courses, virtual classes, tests, student assessment in an efficient and fast way. So it integrates not only the content, but also the assessment and how to disperse the information. The LMS application automates the functions of the administrative department as well of the academic institution. For instance, like registering students, tracking the courses in a particular semester or branch within an institute, maintenance of the records of the students, charting their progress, delivering e-learning to the students, and so on. So it's a dynamic process, and the content must be discoverable easily by the students. Say there should be availability of keywords by which they can search for the content, and depending on which curriculum and what are the topics that they want to access to, there should be very, very easily accessible keywords by which they can go to the particular topic that they wish to learn. And the content must be classified based on study courses and made available to the choice of the student's interest. It must have provision for making annotation and bookmarks by the students for references, and also maybe they need to go back and refer it. And there should be a dynamic content, live animated video, lectures, graphic, audio files, and they must have tools to control while playing the files. Content objects of interest such as text, word, document, image, audio, etc. are a must, and metadata like author, published date, linked courses, and copyright information should also be available. There are various functions and user interface designs which are being programmed on the software. Like it should be very permissible for self-service, and for the students for enrollment to courses. It should be independent and undertake on-demand, offline, and scheduled classes and assessments, submission of the coursework and assignments, manage the student profile, and so on. It should be able to maintain the attendance and calendar, students' library, accessibility, references, reminders and notifications, document management, and then there should be a dynamic chat forum available for any kind of query, and that can be answered to by the facilitator or the teachers who are managing that particular course content. And also the performance review is very important. Facility for student to review his/her performance on the course at individual level as well as against the overall performance of all the students of that particular course. And then subscription to the journals, magazines, new articles. So students should be able to access and subscribe to the journals, magazines, and news articles that automatically get dropped into their user account with notification. And quality standards. The portal design must meet the quality and security standards set out as per National E-Governance Standard. So we at AIMS are presently in the process of developing e-content for learning management system for the National Medical College Network, initially for the undergraduates, and later on, our future vision is to develop the same for the postgraduates, that can be accessed by students and healthcare professionals at medical colleges across the country, and also training early career health workers. Thank you.